Hello to all of you. Can you all hear me? Shall we begin? So today we are here 5 days before FMGE exam to discuss the FMGE predictors of psychiatry. What do we mean by predictor? The most frequently asked topic, most frequently likely to be asked topics, which will be discussed in the form of 25 MCQs. This test has been uploaded. Have you attempted the test of 25 questions on the app? Is there anyone with me live on the app right now? Is there anyone with me live on the app right now who can comment so that I know that you are listening? Yes, shall I begin? Shall we start? Good evening. Hello. Okay, first question. A patient who has taken lithium for some months discontinues it and says, Ocean needs a sail as rat needs a tail. So write your exam and don't fail. Result will be out in a mail. Sail, tail, fail, mail. Sail, tail, fail, mail. Does this question becomes relevant to you? Rhyming. When words are linked to each other by rhyming, we call it clang association. When there are new words, we call it neologism. When there is one word connection, we call it flight of idea. And when there is loses the track, doesn't reach the answer, then it is called tangentiality. Are we clear with all these terms? Are we clear with all these terms? In FMGE exam, they have asked circumstantiality in 2025. They have asked flight of idea 2018. So terminology based questions are asked in FMGE exam. Are we clear with all these basic terminologies? Not tangentiality, not flight of idea, not neologism. Are we clear with all these basic terminologies? Any doubts, any questions, please ask. Which of the following best differentiate psychosis from neurosis? There are two types of patient in psychiatry, one who come, another who are brought. Those who come are called neurosis. Those who are brought are called psychosis. Those who come, neurosis. Those who are brought, psychosis. But the best to differentiate is not loss of insight, it is loss of reality contact. That means presence of delusion and hallucination. अगर आपको एग्जाम में delusion hallucination दिखे तो आप psychosis सोचेंगे. Am I clear? If you see in your exam delusion, hallucination present, you will think about psychosis. Am I clear? Most common hallucination. Still 20 to 30% questions in FMGE are short stem one-liners. Although majority of the paper is clinical, but still 20 to 30% questions are very straightforward. Most common hallucination is auditory, but most common in organic disorder is visual, tactile, cocaine, olfactory, temporal lobe, epilepsy. Are we aware about all this? Are you writing it? I don't think so. So what I'm planning to do, I will share the PDF of this on the FMGE WhatsApp group. Are you connected to me on FMGE WhatsApp group? Say yes if you are. I will share the PDF of this on FMGE WhatsApp group. Are you connected to me on this WhatsApp group? Okay. Inability to enjoy pleasurable activity is known as inability to enjoy pleasurable activity is known as anhedonia, loss of drive or motivation, avolition, loss of emotions, apathy, can't describe my feelings in words. शब्द ही नहीं है अपनी भावनाओं को बयां करने के. टेल मी व्हाट आर यू गोइंग थ्रू एट दिस मोमेंट. इस समय आपको क्या हो रहा है बताएंगे. लॉस ऑफ प्लेजर हो रहा है. मजा आ रहा है कि मजा नहीं आ रहा. नहीं आ रहा. ऑब्वियसली एग्जाम इज कमिंग इन 5 days, क्या ही मजा आएगा. लॉस ऑफ ड्राइव और मोटिवेशन हो रहा है. से यस और नो. पढ़ने का मन नहीं कर रहा है. नॉट फीलिंग मोटिवेटेड और ड्रिवन टू स्टडी. ये भी हो रहा है. एंड इफ आई आस्क यू लॉस ऑफ इमोशन हो रहा है. हाउ आर यू फीलिंग. Is there anybody who can connect to do this? I can't feel anything. Nothing I am feeling. Not happy, not sad. Apathy. And then somebody is like, sir, I can't even tell you how I am feeling. I can't describe my feeling in word. शब्द ही नहीं है भावनाओं को बयां करने के लिए. Can you relate to any of these? I have specifically picked up today's questions for the today's mood. कुछ रिलेटेड महसूस हो रहा है. I exactly know what you are going through. If you are an FMG aspirant writing an exam after 5 days, I can connect what you are going through. It's not a disease, it's normal. Before exam, these things are normal. Loss of interest in previously pleasurable activity. जिस रील को पहले देखकर हंसा करते थे, आज उसी रील को देखकर ना हंसना आ रहा है ना रोना आ रहा है. Even jokes are not making you able to laugh, you know. अभी मैंने कुछ हिलारियस भी बोला ना, तब भी समझ नहीं आ रहा हंसूं के रोऊं. A middle-aged man become detached and start writing poem and story. It could not be understood by anyone because of the language and form and context was also not rational. His language and content could not be understood. Come on, come on, come on. I just said new words which cannot be understood. Is a disorder of form of thought. Neologism. Could you answer this question? Shall we revise the thought disorders? Shall we revise the thought disorder? Come on, quick. Form of thought, content of thought, position of thought, stream of thought. Form of thought, content of thought, position of thought, stream of thought. Form, content, position, stream. Loss of association, neologism, form of thought, delusion, obsession, content of thought, thought insertion, thought withdrawal, thought broadcast, position of thought, and stream of thought, flight of idea, slowing of thinking, perseveration, and thought block. Again, something relatable to you. Crying suddenly without any stimulus. He was previously laughing and enjoying. मैं रोऊं के हंसूं करूं मैं क्या करूं. अचानक से हंसने का, अचानक से रोने का. Relatable. Labile effect. Fluctuating expressions. Cyclothymia is a mood disorder. Hypomania and subsyndromal depression for 2 years. Incongruent affect when mood is happy and affect is sad. When mood and affect do not match to each other, we call it as incongruent affect. Euphoria, happy mood. Blunting of affect is seen in affective flattening was asked in recent FMGE exam. Come on. Incongruent means mood and affect not matching. Mood is happy, affect is sad. Affect is happy, mood is sad. अंदर से खुश, बाहर से दुखी, बाहर से खुश, अंदर से दुखी. Blunting of affect, schizophrenia. Depression is sad affect. Mania is happy affect. Blunting, schizophrenia. Blunting is no expression. First rank symptom. Do you know what are the first rank symptom? 3 thought symptom, 3 perception symptom, 3 made symptom, and 2 special symptom. Made feeling, made affect, made impulse. Thought insertion, withdrawal, broadcast. Auditory hallucination, first person, second person, third person. Do you remember these things? Somatic passivity and delusional perception. Come on. Loosening of clothes at inappropriate places, laughs inappropriately, speech shift from one topic to other. Which schizophrenia this is? Which schizophrenia this is? Come on, which schizophrenia this is? No, loosening of clothes. Organized behavior or disorganized behavior? Organized behavior or disorganized behavior? See, catatonic is motor. Paranoia is suspicious. Simple is negative symptoms. This is hebephrenia. Could you diagnose it? Come on, some of you have forgotten the concept. Could you diagnose it? I am trying to revise and touch as many topics as I can which are important today. Could you diagnose this? Hebephrenic schizophrenia. Not associated with a better prognosis. Late onset good. Married good. Negative symptom bad. Acute onset good. Could you answer this? Come on, please reply in the chat. I'm looking at your chat. Yes, you're answering nicely. So these are the factors for good prognosis and bad prognosis. Read them. Again, not a negative symptom in schizophrenia. Can you tell good and bad? Okay. Late onset, good. Early onset, bad. Stress factor, good. No stress factor, bad. Acute onset, good. Insidious onset, bad. Depressive symptom, good. Married, good. Family history of mood disorder, good. Hiranshi Shah. Is that clear now? Not a negative symptom. Anhedonia. I just said loss of pleasure. Affective flattening. Loss of expressions. Decreased use of language. Answer is automatic. It is seen in epilepsy. Not in schizophrenia. Could you answer this question? Could you answer this question? Yes, no. Which of the following antipsychotic has anti-suicidal role? Come on. If FMGE 6 question comes in psychiatry, 2 question comes on drugs in psychiatry. The commonly asked drugs are antipsychotics, SSRI, lithium valproate. Answer is clozapine. Lithium and clozapine have anti-suicidal properties. Most common indication of electroconvulsive therapy in psychiatry. Most common indication of electroconvulsive therapy in psychiatry. Come on. All these are indications of ECT. Which is the most common? Depression with suicidal tendencies. Could you answer this? Could you answer this? Yes, very good. What is the most common symptom of depression? In FMG they ask key symptom. That was low mood. But I am asking you most common symptom. Anybody knows the answer? Most common symptom. Do you think these questions are useful? Do you think it is worthy of your time spending 30-40 minutes in psychiatry? Give me a thumbs up or a heart if you feel they are worthy. आपको ये डिस्कशन काम का लग रहा है? Yes, no. Okay. Thank you so much. Most common is generalized psychomotor retardation. The core symptoms of depression are EMI, easy monthly installment, low energy, low mood, and decreased interest. out of which most common is decreased energy, generalized psychomotor retardation, and key is low mood. If any question comes from predictor in upcoming FMGE January 2026, all of you have to make it right. All of you. And apart from predictor revision today, tomorrow we have FMGE marathon where I will be revising psychiatry in 30 minutes. We are not going to teach anything new in marathon. It is DFX based. Are you aware tomorrow on YouTube we have FMG marathon in which each teacher is given 30 minutes. I also have 30 minutes. My session will be afternoon tomorrow. Will you be coming live again tomorrow with me? Only for 30 minutes to revise psychiatry. We will just see the most important table in psychiatry. That is the revision chart. My session is 3:30 to 4 p.m. 13 January. We will be having 10 hours revision tomorrow because it is difficult for you to study 10 hours at this moment. So we will be doing marathon revision tomorrow. Minimum duration of symptom required to diagnose major depressive disorder as per DSM-5. 2 weeks. 12th today is last day for MCQ practice and evaluation. Last 4 days, 13 to 16. Only revision, no evaluation. Because evaluation increases anxiety. Evaluation increases anxiety. If you solve an MCQ, either it is right or it is wrong. If it is right, you gain confidence. But if it is wrong, you lose confidence. I don't want any one of you to lose confidence in the last 4 days. Am I clear? भरोसा रखो मेरे ऊपर, आखिरी 4 दिन में MCQ करने से कुछ बच्चे, सभी नहीं, कुछ बच्चे नेगेटिव हो जाते हैं. कुछ बच्चे सोचते हैं कि यहाँ पर ही क्वेश्चन नहीं निकल रहा, एग्जाम में कैसे निकलेगा. So last 4 days, let's focus more on revision. You understand revision? Re and vision. When I tell students to revise, they keep a hand on their page and then they revise. If you close your eyes or keep a hand, where the hell is the vision? So you have to revise, again see, again see, again see. At the maximum, if you want to do MCQ, just see PYQ question and answer. If you want to do MCQ, just see PYQ question and answer. Depression, 2 weeks. Mania, 1 week. Schizophrenia, 1 month. PTSD, 1 month. Dementia, 6 months. Dysthymia, cyclothymia, 2 years. This is the minimum duration required to diagnose. A 16-year-old man with a past history of a manic episode characterized by a illness, characterized by depressed mood, anhedonia, and profound retardation. This is the current episode, this is the past episode. Is it just depression or is it bipolar depression? Is it just depression or is it bipolar depression? So treatment will be only antidepressant or antidepressant plus mood stabilizer. What is your answer? Could you answer this question correctly? This question correct means good concepts in psychiatry. Could you answer this question correctly? You have to tell yourself in next 5 days. Yes, I know it. You don't have to tell no I don't remember. You have to tell yourself हाँ मुझे आता है, हाँ मुझे ये भी आता है, हाँ मेरा ये भी ठीक है, इतना ठीक है तो मैं पास हो ही जाऊंगा, इतना आता है तो मैं पास हो ही जाऊंगा. Please keep saying this to yourself. It will help. There was no psychotic symptom. Both symptom had. Why not C is the answer. Psychotic symptoms were not there. Antidepressant plus mood stabilizer. In unipolar depression, only antidepressant. In bipolar depression, antidepressant plus mood stabilizer. A young man brought to the outpatient clinic by his family member, increased talking, increased alcohol consumption, sexual promiscuity, irritability, decreased sleep, not feeling tired, even prolonged activity. What is the answer? Mania. Increase alcohol consumption, decrease sleep, decrease need for sleep, irritability, not feeling tired. Many students mark it as alcohol dependence because he is taking alcohol. No, all the symptoms are of mania. Come on. Have you seen this topic asked in PYQ in FMG? Have you seen this topic asked in PYQ FMG? 1 week back, tearfulness, irritability, anxiety. Less than 2 weeks, symptoms, blues. More than 2 weeks, low mood, depression, plus guilt, anhedonia. More than 2 weeks, plus delusion against newborn. Are we aware about these three conditions? Blues, depression, psychosis. Are we aware about these three conditions? Low mood less than 2 weeks, more than 2 weeks, plus delusion. Chances of infanticide, psychosis. Mother to child separation, psychosis. Very important topic. Are we aware about these things? सबको आता है ये? Driving a car meets with an accident. ICU for 6 months after being discharged. Gets up in the night and feel terrified. रात को उठ के डर जाती है. Accident. Major trauma. Gets up in the night. Nightmares. Post-traumatic stress disorder. Yes, because it is more than 1 month. PTSD. It's an important topic. HIA. Hyperarousal. Intrusiveness, avoidance. FMGE 2017. Imagine 17 January FMGE exam 2026 picks up a question directly from FMGE 2017. Imagine this is your actual exam happening. Can you answer this question? Worried about having a major disease. हमको एक बड़ा बीमारी है. Do it right. डॉक्टर ने बोला ठीक हो, उसको लगता है बड़ा बीमारी है. What is this condition? Hypochondriacal disorder. Could you answer this? Illness, anxiety disorder. FMG 2020 directly. FMG 2026. Most of the students, they have done previous 5-year question. 25, 22, 23, 24, 21. Have you done 2020 question? 2020 का PYQ किया आपने? बट मुझे लगता है आप कर पाओगे. Stealing money. Bullies the younger kids. Is it oppositional defiant or conduct? Stealing, torturing animals. Physically abusive to parents. Conduct disorder. Could you answer this? They do not violate the right of others, and they violate the rights of others. Delirium. Modified FMG PYQ. For delirium, delusions, and hallucination, we give antipsychotic. Which antipsychotic is the first choice? Come on, quick. Haloperidol. Could you answer this question? Any antipsychotic can be used. Haloperidol is the drug of choice. The drugs rivastigmine and donepezil are used in the treatment of. Sometimes students forget this also. Very simple, very easy question. Dementia. They are acetylcholine esterase inhibitors. And in dementia, there is decrease in acetylcholine. Very simple question. Poor interaction with peers and family, delayed language development, repetitive movement, difficulty accepting change. Does not make eye contact. Come on. What is the answer of this question? No eye contact, no connect with the parents, repetitive movements. Come on. Autistic disorder. In Rett, there is microcephaly and loss of milestone after 1 year. But in Heller or childhood disintegrative disorder, loss of milestone after 2 to 3 years. If you want to read further, Rett only affect females, male die in utero, X-linked dominant inheritance, and microcephaly is seen. Head growth decelerates. Final question. A young man is often the object of his friend's joke because he drops to the floor whenever he is having a good laugh. Which of the following is the man suffering from? Loss of tone on emotional events is called cataplexy, which is seen in narcolepsy. This question student mark catalepsy, which is increased tone seen in catatonia. There is a difference between catalepsy and cataplexy. If you don't read it carefully, you might mark it catalepsy. This was a trap. Did you fell in this trap? इस क्वेश्चन में फंसे आप? 20 to 30 questions in FMG are difficult, undoable. They don't decide pass or fail. You will pass if you do commonly asked questions. Not all right, mostly correct. You don't have to get all correct, you have to get mostly correct in commonly asked questions. That's all from my side. In case you come for marathon tomorrow, I will wish you there. In case you think you don't want to come, this is the final. All the best to all of you from my side. Do share feedback, comments of this lecture. In past 47 minutes we have discussed 25 MCQs of psychiatry. I hope something from this comes in the upcoming exam so that you people remember me and these questions. Thank you. Good night. Bye bye.